You are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Hello and welcome to episode 39 of Extracting Wisdom, the podcast designed to help you prevent the decay of your future. My name is Brandon Evert, and in today's episode, I wanted to share my personal experiences from my first few clinical rotations in dental school. And just a quick disclaimer, I will be staying HIPAA compliant here. I don't want to break any rules or give away any protected health information, so obviously I'm not going to be talking about patients' names or individual situations or anything like that. And with that being said, rotations are something that my class, we haven't done before. So this is something completely new this semester. So it's both exciting and nerve-wracking because it is really cool to start applying our knowledge and assisting older students in the clinic and, finally getting some limited hands-on experience with patients. But it's also a little nerve-wracking, obviously, at the same time because patients are going to be unpredictable. Live patients are obviously a lot different than the mannequin that I am used to in the sim clinic. So you never know what to expect, and you are doing things that you have fairly limited experience with. But this is how you get your feet wet and start learning to become a future dentist. So this semester, my class has rotations in radiology, urgent care, PostGrad Perio, undergrad Perio, and a rotation at a hospital where we get to experience talking with parents of young children and to help educate them on how to make sure their child gets the best oral care that they need. So far I have had 2 rotations through urgent care, 1 rotation through PostGrad Perio, and 1 through undergrad Perio. And so I'll just kind of go through each one and talk about it a little bit. So urgent care was pretty interesting because it is need-based. So it depends on who needs urgent care, whether they show up or not, and the treatment and referrals that they need will obviously depend on what problems they present with. And typically, the biggest chief complaint that I've noticed in these clinics, or the biggest reason patients come through urgent care in the first place, is wisdom tooth pain. I originally thought I would be seeing a lot more trauma-induced problems, but I haven't seen too much of those yet. But regardless, these 2 rotations were pretty fun because I got to help take vitals, take medical history, x-rays, and some basic endo vitality testing. And this may seem, very boring or routine, but doing this on an actual patient is super exciting because we have learned about this during countless lectures and performing these on our classmates. But now we finally got to practice these on live actual patients to help improve their oral health and kind of help come up with a diagnosis so they can get the care that they need. So that's pretty much the basics of urgent care. Moving on to PostGrad Perio. This one I was really excited for because you guys all know me. I love implants. I love kind of the bloody side of dentistry. And this is where they do those things. They do implants, they do grafting, and a whole bunch of other awesome procedures, which I really like. But when I showed up that morning, all they had planned for that day were extractions. So I was a little bummed that I didn't get to see any of the more intricate procedures, but it was still a really good experience because I got to assist on that procedure and help suction and retract and help snip sutures and get a really good view of some more invasive extractions. And I got to keep the teeth, which was a plus because we are going through our endo course right now. So that was pretty much PostGrad Perio. It was pretty straightforward. And then the most recent rotation I had was undergrad Perio, which pretty much involves either COE, which is a comprehensive exam, SRP, scaling and root planing, and phase 4 recall and maintenance appointments. So this was a really fun rotation for 2 reasons. And the first one is that I got a lot of hands-on experience with probing a periodontal patient because up until that point, we were probing our classmates, and dental students, they typically take pretty good care of their teeth. So we didn't really get to experience probing, some of those deeper probing depths. So that was really fun. I also got to help identify furcations with a neighbor's probe. I checked mobility and took vitals. So I really enjoyed that. But the second reason I really liked this rotation, I just had this surreal moment when the patient was naming some of the medications that they were on, and I knew every single one. I knew all of the mechanisms of action and exactly what they were used for. And it was just really cool to now have that knowledge to understand the patient and their medical history and why they are presenting the way they are, and to have a good understanding of what their treatment plan is going to be. So it was just a great experience. And, that's really, I get sometimes we're stuck in lectures and we find ourselves wondering when we're going to use this information. Is this really applicable to the clinic? And almost always it is yes. Paying attention in class and lecture, you got to keep in mind that this is going to help you when you get to the clinical setting to understand your patients better and to be able to deliver the care that they need. So overall, I've had a great experience so far with my rotations, and I'm really excited to go to my other upcoming ones throughout this semester. But before I wrap this episode up, I know this is going to be a shorter episode, which is hopefully nice for you guys. You don't have to hang around and listen for 45 minutes. But I just wanted to share just a couple things that I think will help you get the most out of your rotations. So first thing, and I think this is one of the most important things to remember, is always say yes. Okay? If the student you are working with that you're assigned to during your clinic asks you if you want to probe or help take medical history or numb the patient up, your answer should always be yes. Okay? You might be nervous, and I completely understand that because, I get that way too sometimes, but here's the reality. You're going to have to be doing this on your own sooner or later. So might as well do it now, right? So you might as well get some practice in while you have someone else there to supervise and to help you out. And it's only going to help you develop your skills and gain confidence in the clinic. So seriously, always take advantage of those opportunities and say yes. Secondly, always ask questions. This should be a given when you're on your rotations. You're there to learn first and foremost, so ask as many questions as you can. Don't be afraid or embarrassed to ask these questions, and getting answers is what is going to make you a better future clinician. Okay, third and last thing is to try to apply as much knowledge as you can and sort of come up with a treatment plan in your head and see if it matches the older student's plan. So for example, there was a situation where I was in urgent care and the treatment plan was created and we had all of the radiographs and consults set up and the whole 9 yards. And then everything had to get thrown out of the window because of a high blood pressure. And you will learn that the administration of local anesthetic is contraindicated in patients once they start getting into that 160 to 180 systolic range. And it was really cool that I understood that before the older student discussed that with the patient. And that brings me to this last kind of point, pay attention in class, right? I know it sucks sometimes, and I've already mentioned this, it's tough to sit through long lectures, but seriously, that is your foundation for your clinical knowledge and your clinical decision making. So we really have to be experts and masters of everything from the floor of the mouth on up, whether it's pathology or understanding treatment planning and diagnosing. There's so many things, so we need to know it all. So pay attention in your lectures. Well, I think I'm going to start wrapping it up here, folks. I just wanted to give you my 2 cents on rotations so far. I've had a lot of fun and learned a lot, and have had a lot of interesting experiences so far. So hopefully you enjoyed this episode. As always, if you ever have any questions regarding anything dentistry, whether that's what the life of a dental student is like or getting into dental school or anything, please go ahead and shoot me an email at Bevert, which is Bevert.dental @gmail.com, or you can send me a direct message on Instagram at BrandonEverett.DMD. And don't forget, if you are a listener of this show and you listen to it on iTunes, go ahead and give this show 5 stars. I would greatly appreciate it. And as always, guys, thanks so much for listening, and I will see you in the next episode.